Good afternoon. I am back to talk a little bit about sickle cell disease and answer some questions that people have. I will be looking down at my phone periodically so that I can answer the questions that I've been receiving. So, of course, you all know that I have interest um, in sickle cell disease. My son had sickle cell disease, has sickle cell disease, and he was cured through a bone marrow transplant. And I feel very passionate about advocating for not only better therapies, but for a cure for sickle cell disease, and really participating in the fight to cure sickle cell disease. And so I've been getting questions from people, and also keeping in mind that that a lot of people that might have connected with me through the YouTube channel are people that are living outside of the U.S. And so I kind of wanted to talk a little bit about resources that might exist for them in their country, and what that means. In general, if you are someone who's considering a bone marrow transplant for yourself or for your child, it's very important that you know what the options are for you in your country. And generally speaking, most countries either have academic centers or research programs that are specific to sickle cell disease, and may very well have bone marrow transplant as an option. And so the first step is to seek out the best academic centers that you have in your particular country. If you are someone who is living in the US, then the option would be to seek out the academic centers that are near or closest to your home. It is more likely that you are going to get the best options at an academic facility, because they will not only have resources for you, whether it's research programs or clinical trials, but they will also have options for better options for treatment, as well as options for bone marrow transplant if that is an option for you or your child. The second thing to do would be to get information and resources within your community for bone marrow transplant and what that entails. There are also specific sickle cell groups, as well as community programs that can assist you with that as well. And so the first step would be to tap into your network within your community, whether you are abroad or in the US. Um, Seek help through an academic center, because an academic center or hospital that is strong with research and academics and transplant options, that will give you the best chance for tapping into resources that can assist you. It's also important to consider the financial uh, um, options to that. And if you're someone who is concerned about that, of course, it makes sense that you would be concerned about the financial requirements for a bone marrow transplant. And so, if you're living in the US, for some states, such as Pennsylvania, for example, most people will have options for insurance through the government, such as Medicaid, for their child who has a life-threatening illness, such as sickle cell disease. And so, if you are living in a state that might have that option, make sure that you apply um, for a secondary insurance, because whether or not you have an income, even for people who might have a pretty decent income, that is still an option for them. And so there are options for insurance coverage if you don't have the options, but you first have to make sure that you are exploring that resource, checking with a social worker if you're not sure, or the hospital where you or your child is getting care. And so that will relieve a lot of the financial burden that people might be concerned about. So if you're someone who's also concerned about the financial burden, whether you're in the US or outside of the US, there might be not only options there through um, your insurance carrier or Medicaid insurance in the US, but there might, outside of the US, there might also be options. And so, what I'm stressing here is that if you don't ask, you won't know. And so advocate for yourself, advocate for your family, and ask the questions. A lot of times we are locked out of whether it's better treatments or transplant or anything else, simply because we don't ask, because we think that we might not have options, but you do have plenty of options. And so I wanted to come on and talk about that because I have been getting questions about it, and I realize that there are people who really just kind of want to hear um, just what should they do next? What should their next step be? Another question I had was, well, how long does the process take? Uh, I have detailed videos about the bone marrow transplant process and what that entails. But I know, sometimes people just kind of want the quick answer. You don't necessarily want to go through a long video to get that answer. So in a nutshell, for my son, we started the process to transplant in June, and which involved a testing. They had different tests to check on his lung and his heart before the transplant. He also needed blood tests, as well as my daughter, who was the donor. And so that occurred within about 4 weeks before he was hospitalized for the first conditioning phase. And then he was then hospitalized the end of July into the beginning of August. And at that point, he had the chemotherapy, which is the conditioning phase to clear out the marrow, the bone marrow, before the bone marrow transplant. And so the bone marrow transplant is kind of anticlimactic because it's the shortest part of the entire process, the entire hospitalization phase, which really happens within a few hours. It's essentially similar to a blood transfusion where you have a chest port typically that's placed in the chest, where you get your chemotherapy and all the different medications that they'll give you through an IV, which I go into details about in one of the videos. And so the transplant is done really within a few hours in one day. And although the hospitalization itself lasts between 4 to 6 weeks and can be longer depending on whether or not you or your child has a complication. And I say you or your child because some people are interested in bone marrow transplant are adults, and other people might be asking questions for their child. So for my son, the hospitalization phase was about 6 weeks. He did have elevation in his liver enzymes, and so they wanted to evaluate for that and figure out what was going on. And so for us, it was about 6 weeks. Some people it might be 4 weeks, others it might be longer, depending on what's going on. And so it is very important for you to have some form of support, family support or friend support, because you will need it through that period of time. And you will also need it during the post transplant phase. For us, when our son came home post transplant, again, through the whole process, my husband and I were both working, and we really needed that support to help us on days when we were very exhausted. And so, post transplant, the first 3 to 6 months are the most challenging because they're on a lot of meds, and you have a lot of follow up with the doctors. It starts out at once a week, possibly, then twice a week, and then as you go on and things stabilize, they get spread out for a longer period of time. But it's very intense at the beginning. In the first 6 months, it takes a lot of vigilance and keeping up with things, making sure that if it's you going through the transplant, or if it's your child, that they're getting taking all of the medications as prescribed. And so you're also looking out for complications and things such as fevers. For us, it was a blessing. Our son did not have fevers initially, coming home during that critical post transplant phase. And so it was a blessing, because obviously, if there are complications, that means that you might have to return to the hospital, either for yourself if you're going through the transplant, or for your child. And so we had a pretty uneventful time post transplant, because our son did quite well during that period of time. But that might not be the case for you. So it's always important to consider that post transplant phase, during that first year, that is going to be a lot of doctor follow ups with the doctors. The initial phase of medications, at least the first 6 months, that might require you or your child, again, staying on medications for that period of time. For our son, he was off almost all the medications, and that's the immunosuppressants, within a 6 month period. And so it takes a lot of work monitoring labs, checking on the bone marrow, making sure that those donor cells are doing what they're supposed to, and making sure that sickle cells are not coming back. For my son, like I said, he did very well. His bone marrow and my daughter's cells have done well with my son maintaining that and not having the sickle cells come back. Some people might have some sickle cells come back, but again, that is okay if 70% or more of the marrow has the normal healthy bone marrow cells. And so ideally, you want there to be no sickle cells coming out of the bone marrow post transplant. But even if there's some sickle cells coming out, as long as it's not the majority, then that means that you are in a state where your body is no longer functioning as someone who has full sickle cell disease. And that is life changing and transformative. So I hope that answers some of the questions today. If there are people that's coming on after that have questions, the live stream will be there for you to go back, rewind, and take a look at all the things I mentioned. I do see that people are on. At least one person is currently on. So I didn't see you post any questions in the chat, but feel free to do that. Or just comment, and let me know if I was able to answer all your questions. And I can always just, go in and check the comment and respond to your questions as well. All right. So I hope that, that was informative and helpful for you. And I will continue to post on sickle cell as well, and answer questions as we go along. So I hope you're having a great day, and I'll see you guys in the next video.